Hello guys, I want to discuss a very important topic today. I have been receiving several questions concerning this. I told you guys I've been busy for several days now. I used to produce video before. I used to make my videos as reduced. My posts on my page as reduced. It's due to what? A lot of engagements. So I've been busy for several days, but trust me, very soon I'll be less busy and I'll be making regular posts, regular videos. So as usual, but these days I want you to endure with me. I want you to be patient with me. So this topic concerning fallopian tube blockage and ovulations. Some of you are confusing based on the question I've been receiving on my inbox that, doctor, if I have tube blockage, can I still ovulate? Okay, these questions, I want to treat this question. If you are a GTC woman, you have been trying to conceive a baby, I want you to watch this video from the beginning to the end. Do you understand? Because this topic is very essential. And when you know it, you have known it forever. Are you getting it? So you will not be repeating the same question over and over again. Okay, concerning this question that if you have tube blockage, can you still ovulate? The blockage could happen at the end part of the uterus or the end part of the ovary. There's end part of the uterus. There's end part of the fallopian tube that connect to the uterus. It depends where the blockage occur in your fallopian tubes. If the blockage occur close to the ovary, this may prevent egg to be released into your fallopian tube. Do you understand? If the blockage occur close to the ovary, it happens in the tubes that close to the ovary, that may prevent egg from moving from the ovary into the fallopian tube. It depends where the blockage actually happened, and it depends on how severe the blockage is. But let me tell you this. Having a tube blockage does not mean you cannot ovulate. You can still ovulate even if you're having tube blockage. The ovary will still release the egg, but the egg may not reach where the ovulation is supposed to happen. Are you getting it? So ovulation may not be stopped by the blockage, because the cause of blockage are complex. It could be you're having adhesion, it could be you're having the fibroid, it could be you're having a pelvic inflammatory disease. So these are the risk factors of fallopian tube blockage. Why some women are having ectopic pregnancy? Do you know ectopic pregnancy is the pregnancy that occur in the fallopian tubes? They keep growing inside that tube. Instead to move to the uterus to start growing, they begin to grow in the fallopian tubes. Do you know what? Sometimes there could be a very narrow fallopian tube in which fertilized egg may not have the chance to pass through that narrow tube. So sometimes it's because even when your tube is narrow, you still ovulate, but the size of the egg is bigger than the size of the sperm. So this is why that it may be very difficult for fertilized eggs to pass through that narrow tubes. So ovulation can still occur while you are having fallopian tube blockage. So if you want to know either you have tube blockage or not, you have to go for a test called ASG, this hysterossalpingography test. This test is a contrast or medical test in which doctor will examine your fallopian tube by introducing a dye into your fallopian tube to check if those dye will move freely through your fallopian tube into your pelvic cavity.